Hi, my name is Adrienne Brown, and I did my preceptorship inside the emergency department at St. Joseph Medical Center in Tacoma.
Hello, I am Jesse Valitalo. I did my preceptorship at Covington Medical Center in the emergency department. The title of our presentation is Nursing Care of a Patient with Dementia in the ED Presenting with Catheter-Associated Urinary Tract Infection from a Skilled Nursing Facility.
And what prompted our interest in this topic is that we were seeing a lot of older adults with dementia come in through our emergency department with Foley catheters already in place. In each instance, EMS did not know how long the Foley had been in place, nor was there any information regarding the history, patient health history in the packets. And every single one of those patients were suffering from urinary tract infections. It's amazing to know that an estimated 14% of a 5.6 million patients suffering from dementia each year are sent to the emergency department from complications of long-term use from urinary catheters. Long-term use is stated to be 30 days or more.
All right, moving to the case study, our patient is from an extended care facility and is brought into the emergency department. She's 89 years old with a history of mild dementia, neurogenic bladder, vestibular reflux, and polycystic kidney disease with non-localized abdominal discomfort and flank pain. She has incontinence and new onset mental confusion and loose stools. She has an indwelling catheter with an unknown placement date. The vital signs are 118 over 60, 95 is heart rate, 18 respiration rate, and 98.4 degrees Fahrenheit. The provider orders the urine sample to be tested, and it comes back positive for E. coli. She is then admitted to the floor and completes antibiotic therapy. Her catheter was discontinued when she was admitted to the floor, and once her signs are good, so her urine output is adequate and her mental status is returned to baseline for her, she is then discharged.
So as we go into the assessment, we see that that flank pain is associated with polynephritis or assault to the kidney, or abdominal pain is indicative to a bladder infection. We also could note that a cloudy urine also is suggestive of a urinary tract infection.
And then continuing with the literature review with the interests, one thing that I found was while looking at the manufacturer's suggestions, they suggested 2 to 12 weeks for a urinary catheter, which is a very long time, a high chance for infection. Another very interesting thing was immunosenescence, which is the suppression of the immune system as someone ages. And yeah, and then continuing to the reinforced things, the things that were reinforced when we looked into the literature was that, for one, having a catheter increases your risk of infection, period. Infections can lead to many different complications, so it's important to get on top of those. And then also what we saw in practice was when we were in 220 clinical, which is way back at the beginning of our nursing careers, we would see those in the retirement facility that had catheters and we did not know their placement dates. And at least for me, going through that whole time in my clinical, that patient always had a catheter and I never once saw it got changed. And it's not necessarily taken care of the best. It wasn't uncommon to see the bag on the floor, and those are not good for infection control. And so some takeaways from our poster would be that immunosenescence, so that lower immunity as individual ages. Another takeaway would be that patients with dementia have a lower urine output, so their bladder will not empty all the way, which is another risk for infection. And then Women have a shorter urethra, and because of their proximity to the bowel and vagina, that also increases risk for urinary tract infections. And then the last takeaway I would like to point out would be that it kind of appears like there's a lack of accountability for nursing homes, and especially their use of urinary catheters.
So we want to go into a couple more things, that there needs to be a focus on diagnosis and prevention and interventions for patients suffering from dementia, experiencing a urinary tract infection. We need to keep in mind that the untreated infection does lead to further complications. And in a dementia patients, those can be quite confusing, as they already can be confused. So as far as diagnosis goes, there could be an increased risk of infection due to the long-term use of catheterization, as noted by the abdominal discomfort per our case study, as well as that decreased immunity related to the infection, evidenced by the increase of white blood cells. And we know that there is also a knowledge deficit related to the disease processes by the inappropriate use of catheterization. So nursing interventions could include not only doing a culture and sensitivity test to see if white blood cells are greater than 10,000, keeping in mind the immunosenescence as it relates to the older folks and their decreased immunity, as Jesse mentioned. Nursing interventions also includes the surveillance and monitoring. Again, this is preventing the use of catheterization as a whole at the skilled nursing facility to keep them from coming into our ED. We want to reinforce hand hygiene for infection prevention, and we also want to have the patient toilet on a regular basis, also by offering them fluids that they like to drink so that they can flush out their system and keep their white blood cells low. Again, we want to try to teach the providers on the appropriate use of catheterization. And when it's not, again, we want to not have this patient use catheters at all. Also, they need to consider the overuse of antibiotics. So in doing so, in the end, our patient will be free from infection in the ED upon discharge and not show any symptoms or elevated signs of decreased mental status from their baseline. But not only that, we want them to be free from the catheter altogether by discharge. So in doing that, we want to have that urine sample. We want to make it free from contamination, but also we need to keep in mind that prior use of antibiotics may actually skew those numbers as well. We want to be aware of the symptoms of a UTI and try to separate that from the symptoms of dementia and mental confusion from that. We want to also address the teaching drawbacks. Maybe it is at the nursing facility. We need to find where the holes are. We need to keep in mind that there's also barriers to this implementation, as Jesse mentioned before, that there seems to be a lack of accountability. Maybe it be documentation, or nurses not following the nursing process all the way through in AUTI form. So with that said, I'd like to thank you for watching our capstone. And I'd also like to thank Karen Schober at St. Joseph Medical Center ED for her continued support.
Yep. Thank you for watching. I'd also like to thank Andrew Calhoun at Covington Medical Center in the emergency department. He was my preceptorship. Thank you.